So welcome back to the second part of this video, dealing with evaluation management. So we're going to be talking about the modifiers. So one of the things I want to emphasize about modifiers, so modifiers are designed to do two things. They provide information and then they also affect reimbursement. So the modifiers that we're going to be talking about today affect reimbursement, and then one of them provide information. So modifier 24. So the definition for this is unrelated evaluation management service by the same physician or other qualified healthcare professional during a post-operative period. So when we think about post-operative period, we're thinking about, okay, the patient has had some type of major surgery. And if that major surgery is, for example, a breast mastectomy, anything that they have done within that 90-day global period for that breast mastectomy is going to be bundled. Now, if they have a procedure that's totally unrelated or they have an office visit that's totally unrelated to the mastectomy, then that is considered to be a billable service. And so that's when modifier 24 will be applied, when it's totally unrelated to the surgery that was being performed. Modifier 25. So I'm going to give you two examples of modifier 25. So modifier 25 can be used when you come in for a wellness exam and you also have an office visit as well. The wellness exam, of course, is going to be for your preventative medicine. But if the patient has another problem and the physician addresses that problem during that encounter, then that becomes what we call a sick visit. And so you add modifier 25 to that sick visit code. So the definition for modifier 25 is significant, separately identifiable evaluation management service by the same physician or other qualified healthcare professional on the same day of the procedure or other service. So think about if you're having a minor procedure. Now, if the office visit was what was scheduled and then they come in for the minor procedure and everything is determined on that day, then you consider that to be a separate E&M service as well as the minor surgical procedure. But if they're only coming in for the minor procedure, then you cannot bill for the office visit. You just bill for the minor procedure. So those are two examples that you can use to understand modifier 25. The next modifier is going to be modifier 32. So that means mandated services. So that means that there's a third party or governmental entity that is requesting a second opinion. And so this is considered to be mandated service. So it has to be a third party or governmental entity that's requesting service. And so modifier 32 will go on that E&M code. And then the last modifier is modifier 57. So this is a decision for surgery. So an example that I would give you for this one, so you come in for abdominal pain, the surgeon decides that, or the physician decides that you need to have an emergency appendectomy because the appendicitis is just that severe. And so the office visit will get paid with modifier 57. And then once the surgical procedure is billed, as long as it's billed the same day or within that 24-hour period, then both of those procedures will be paid, the office visit and then the appendectomy, if that is the procedure that is billed. So those are the four modifiers that apply to E&M. Now, if you would like to learn more about medical coding, I do have a medical coding prep course for individuals that have completed a formal medical coding training program at a career college or a community college. So reach out to me online at paulaandersononline.net. That's paulaandersononline.net. Or you can email me at paula@paulaandersononline.net. That's paula@paulaandersononline.net. Stay tuned for the next video. I'll talk to you soon.